coronavirus still remains a huge threat to public safety in Zambia. On a daily basis, the nation still records hundreds of cases. Since the first cases of the coronavirus were recorded in Zambia in March 2020, the whole nation was given guidelines on how to help stop the spread of COVID-19. Social distancing, masking up, and frequent sanitizing are some of the main guidelines. Schools, bars, and sports activities were banned for over 5 months. However, these were revisited when the nation recorded a reduction in cases. The Copperbelt province is Zambia's main economic hub. The province was one of the first to adopt these guidelines. Masking up was a serious issue here. However, the public has largely ignored these guidelines. In Kitwe, sanitizing and masking up was serious in bus stations.
When this COVID-19 was just introduced, our business kind of went down, and we experienced quite a lot of losses. We are grateful to government that they never closed down. If our business had gone down, but bit by bit we are surviving. It's kind of funny that the young ones, let me say maybe from 20 to 35 or 40, it's like they don't understand the value of life, you know, and it's in this category of group, in this category of age, let me say that, where you find mostly are the ones that don't mind putting on a mask. These are the ones actually that give us a lot of problems. When you come to people that are a bit elderly, 40 going up, it looks like they understand the value of life, and you don't even have to tell them. They're already coming with their masks on. They would even ask at times, oh, where is the water and the soap so that I wash my hands.
Ideally, really, there is not much we can do if a passenger insists that they don't want to put on a mask. We haven't got the arrest powers which the police have. There is absolutely nothing. We can only appeal to the traveling public to basically follow the health guidelines given by the Ministry of Health. In our case, we just re-emphasize the guidelines given by the Ministry of Health, which means before a passenger boards our bus, they must put on a face mask. That's point number one. Number two, they must sanitize, wash their hands. Then they will be allowed to board our bus. Then we take them to their destination. Basically, that's what's happening. And we have seen, following those, we have kept running. And we are grateful to the government. We haven't been closed down.
Still in Kitwe, Chisokone Market is the largest market on the Copperbelt. Here, over 10,000 traders operate from this crowded market. However, almost everyone has stopped masking up.
Nimpai 10 boxes para vena nguibili na sa shoro chero na order na yimi. Nomba ino instano wa 4 boxes kusha mo 2 days. 2 days na transport ukwere 10 kwacho kubwera. Nefi yakulia kunganda na bana so instokura kwa ke page yonse. Awo tayiweme. Tula muna kwa tina ichepa na kwa hapa. Eko tule mona. Nonga chali mina ichepa na kwa hapa nevina maskuru ya isko kazi kutola mask kunganda. Kadi kwa muna kwa tiiri ko efiri yako. But kuchachi tulafwala mask ye. Market mwana tuwe mwati kwa kabako na ichepa na.
Abe ngita bashiningisho kwe bati corona uko yaba. Nefo tabadefwalira mamaski. Obusanso bwena kutubwaisa pantu umuntu umongalo aranishabala ba affected bengi pa market. So kutifya sangwa. Abengi bale punda tinga babike pa maski pakanwa umwera ula chepa tabapema bwino sokulaba chimwabikako panono mwafumyapo mlandu wakana apema bwino
tatufala yona nishifwere nachilaba kuganda nachilaba kuganda nayo nishifwere kutina awe twalile tatutina covid fina namba tu okay kutwanda shani tatuitina namba twalile kafyo kufwala twale kafye tatuishibe fefo bene kutontonga awe bali maski pera twalufya kama twatukufa twonka nani gafya vote ko letu bafya fefo twafwala so kufula kwa twalufyanya bantu ko vitapwa so twalufyanya fefo bene twafula
baji bambi balefwala nomba bambi tabalefwala emkai utatuishibe fefo tabalefwalila mwanjini kaili baleko nkefya buteko balefwala kwenda na pano pene ifo tatukwete tatuishibe mwanjini ebichirengere akatina kairo mokaba nomba kwati kubula fyo kufwala
The Association of Vendors and Marketeers of Zambia, AVEMA, represents traders in the country.
Yeah, the issue of coronavirus, comrade, that affected us a lot. You know, with the issue of social distance, when customers want to come at once and get, so it has affected us a lot. And you know, most of our customers are scared to come in public, to come and buy. So it has really affected us, especially in Sokoni. Those that are selling vegetables, now most of our customers are preferring going into shopping malls where there is social distance than coming into the market. It has hit us very heavy. AVEMA is an organization of informal workers. It depends mainly on well-wishers. We are doing our level best. We have about 13,000 masks that are being made now that we intend to give out free of charge to our workers in informal. Our Honorable Minister, Honorable Chiteme, did give us some sewing machines that we are using with the little resources that we are having. We are making up about 13. By tomorrow, we are at about 10. Maybe going forward by Wednesday, Thursday, we'll have 13,000 that we'll share and give out to marketers at Sokoni.
If the formal workers are affected, we are worse affected. Worse affected because our dependent of our livelihood is dependent on what we get on the daily basis. So the loss of business is the loss of livelihood to all of us. Because what COVID-19 has brought in our lives is firstly that our businesses have been diminished. We don't work. And especially those that are doing cross-border trading, when borders were closed, it meant that all businesses had to close locally. For the other businesses in markets on the streets and also peasant farmers, it meant that first the foods that were coming from the farmers ceased to come because people were afraid to bring their foodstuffs. Secondly, people were also very much afraid to come to the markets, so the clientele also reduced. Meaning, if I was getting a 20 kwacha per day, I was reduced to get a 2 kwacha, 3 kwacha per day. As you may be aware, we are still going around the markets and bus stations, sensitizing both our members and also customers on the importance of observing the health guidelines. So it's just very much surprising that we are seeing people not observing these health guidelines that are given to us by the Ministry of Health. I think my question to my colleagues is that, you know, when we are talking about COVID and it's away from you, it's like it's a myth. But when it comes near you, it's when people they will see and understand the graveness of these diseases. So colleagues, it's important that we adhere to the presented guidelines given to us, because always, as I mentioned, prevention is always better than cure. if we are reading and we are seeing MPs, if we are seeing well-established, wealthy individuals dying globe-wide, it means for a common individuals, for a common person like Ashua, whose even attachment to health facilities is far connected, we are very, very near to death. So it is just important that we all adhere to these guidelines for our own safety and also for our own prevention to catch the disease.
In the education sector, private schools are also struggling to meet the health guidelines.
It's been quite an exciting year as well, though we have been hit with the pandemic of COVID-19, which has not only hit Zambia or Africa as a continent, but the world globally. And as for me, as a founder of Cook's Daycare, it has affected me somehow with other teachers that are in Zambia. Of course, we were told to close with immediate effect. We never planned that we were going to close the term halfway. That was our first term, the beginning term of the first graders. So when the government officially told us to close, we had to close with immediate effect. And from then, children had to go into total lockdown. It was total lockdown for all of us. As a private school teacher and as a founder of this school, we could not have an income that would help us sustain the school itself or improve the services of the school, or we wouldn't continue to finance the orphans that we were taking care of. It was a stop for us, yes. And so negatively it affected all of us. My advice as a teacher to my fellow teachers, now that we have just opened schools, we need to make sure that we put up the strict measures of how to eradicate the pandemic of COVID-19, which is washing of hands. We have to ensure that our children wear face masks most of the times. And we need to ensure that even ourselves as teachers, we are leading by example by washing our hands with soap, using hand sanitizer, practicing at least 1 meter away social distancing. And then the other children that are seeing us, we imitate that. Yes, and then globally, even to other nations in Africa, we need to make sure that we follow these regulations. COVID-19 is real. People of Africa, let's not take it simple, or let's not taking that maybe our leaders are lying to us. COVID-19 is real. We need to take it serious, more especially that most of the countries have opened schools. So let's protect our children from COVID-19.
In neighboring Mufulira, the situation is the same. Taxi drivers find it difficult to enforce the health guidelines.
We are losing business here. As you can see, people, they are at home, they are not moving because they are fearing of this COVID-19 that we are having. As you know, every Zambian, they know it, and it affects us in every corners of business. Sometimes we face different people. Being at the station, you are facing a lot of people. Some they are complying, and some they are not. They are saying there is no COVID, and we keep on emphasizing them. But no, there is COVID, because you can say that there is no COVID because you are not affecting it. But if you are affected and your family affected, you can say how there is COVID. But there's some people, and each and everyone knows that you are having these problems. And the numbers of the people who are affected, they are already given us. Today you have new cases, 200 new cases, 300 new cases. So we keep on emphasizing our customers that there is COVID, and this COVID-19 is real.
Other people are saying there is no COVID-19 in Zambia. But as myself as a taxi driver, I know this is a real disease. I can even encourage other fellow taxi drivers to be serious and conscious, more especially on washing our hands, putting on our face mask, so that we even protect our families at home. Because me, I'm here, I'm working, my family is at home. When I go there without protecting myself, I can even put my family into risk. So I can encourage many Zambians to take this COVID-19 as a serious issue.
COVID-19 should be a concern of everyone in Zambia. Currently, we are not safe. We are not safe because of the relaxity. That is, I think from the camera behind me, you are able even to count how many people have got their masks on. Very, very few. And this is a very big concern because this relaxation, this passivity that has come, it means COVID-19 transmission cannot be cut. And this is why within our own capacities as Action for Development, working together with the Zikomo Taxi Association and the Bus and Taxis Association of Zambia, as you may have seen, we are on point to continue to talk about people to mask up, people to wash using hand sanitizer, people to wash using water and soap, and people to stay at home if there isn't nothing very pressing to come into town for, and people to do social distance in an event they are in a place which is quite congested. So yes, we are concerned, and it is all because COVID-19 should not be an issue for an institution alone as Ministry of Education, Ministry of Health, but it should be an issue for all of us to collectively fight.
Batituleshana maka yonse kwe batu wasamba fyonse panse pofili sapu vya kusamba kumino vya kusuba na mimi tuka mwine tula sansamo bakutira bekatulesha ukulonga kabinga batu bati mnelonga ko impendwe inono nishikaire ya mfuta yabashani yabe inono so tula posa kwa manu sana bakutira uteko bwa munati aho tule bombya nabo chapa mo bakutunga chimvi akakaburwele kaisa kakafu kafuma kubalungwano kukuma kwasungu wene yo amashwingwete kankala kwena amashwingwete akubakoselesha ya palango kutila ngati ntule kumpa mayanda bela sule fyo buteko buletila bantu buteko bantu baturekesha bukabije bashitane imitishine wabino burwele kuti wasabu son polari mikumbasi bus stop ku market obo wala twalira ni balukwa obe mukati kanganda ira.
Civic leaders are concerned about the laxity among Mufulira residents.
COVID will take you within a short period of time, you are gone. But I can concur with you, there is this laxity, and more so that our friends in the opposition are not helping us. Whatever we are trying to do and put things in place, everything comes under opposition. No, it's fake, it's not real, no, government wants just to do. Gentlemen, let's put our heads together and salvage and preserve the population of Zambia. We are here because of the people, and if we don't have people, then who's going to vote for us? Whom are we going to lead? So this thing shouldn't be political. Let it be something that should be looked at with all the seriousness it deserves. We're talking about life. So my appeal is to all NGOs, opposition parties, and any other person who values life, please, let's observe the COVID-19 rules. They are very simple. It's all about hygiene.
In Ndola, the situation is the same. Stakeholders are concerned.
Namona ikolona yaisa. Yani tusaffecting and for our business. Tuashala fya mapopa. Tuendela fya rosalwa kwalesa. Na bwana buteko ngabutu tontonga shapo kufafa bunga tontonga shapo. Ikufyara fya banenso. Bali batontonga shapo kuba booster kofimu. nomba ifo tepacho batubusta kolona toshara fe mulast but turepitana fe dusaba kwalisa turenda nalo majority abengi nokufana abafwa so batutontonka insheko bayedziga lungu nentungulu shabo ekuyishanya kwesoko turengishanya
but ubuteko wali tuchita ku advise ukwe bati tufuire turenda na hand sanitizer then twalikwatako n'ama buckets eyo batebekwa turebika ama buckets turesambako ngatapali hand sanitizer sopo natubika iringina nkuma handbag twalikwata tuma hand sanitizer filafini amenshinga tapali mupepi tulabonfya hand sanitizer twasansa kukuma boko luture chinja nyendalama na bakastoma kwa ama mask yena tatufuere panopo tuli but ngefine mwamo n'abantu nga bafula sana epo tuikere ama mask enepo yali tulayabonfya
twalibolela kuno mulandu twalikala no business ifya sana twamba fe nombo kongola mulandu wakwe bati no capital bwino kaya bashisha babomba baleko okubomba so bale tujombola sana ba customer bale bomba mba customers twalilushira ba customer mulandu wako lona tapale fa tuingalola byafine batata batwafana kai batololesheko.
The issue of coronavirus, I think this is a worldwide thing, and especially here in Zambia, specifically in Dola, our people under the association, they are very much affected. And I think this thing has come just to shut down the whole system. I think in terms of business, people are complaining. In most of these markets, you can even see the pace of the movement of the people. It has totally gone down because of the same virus. So it is just by the grace of God to see people surviving. But the issue of corona has really affected our people. The Honorable Minister, Honorable Chitaru for Health, was on TV encouraging people to put on masks. Because as we are talking right now, we are going towards the second wave of coronavirus. So meaning Saturday will be the last Saturday of the month, meaning we are going to do the issue of Keep Zambia Clean, Green and Health campaign. So I think when we are going to gather this information of putting the masks, I think will be spread on that day. And come, I can assure you, Mr. Shalala, that come next week, Monday, we are not going to allow any marketeer, any vendor who is not going to put the mask to enter, even on the street or in the market. We are going to spread this news even to the people who are coming to buy our merchandise to make sure that all the customers must put on the face mask. Compliance is not as good. People have relaxed on the prevention measures of the COVID-19 pandemic, which is something that we've been actually trying to overcome, and we still are. We're doing this through sensitizations and various engagement at community level. As a local authority, working with other stakeholders like the Ministry of Health, we're involved in community sensitization, and we target potential hotspots. The potential hotspots, we mean places that are crowded, places like markets, shopping malls, schools, obviously before they closed, and also with the reopening of stadiums to the fans. What we are doing as local authorities, we're engaging management at the stadiums. Example is this one here, to make sure that people comply with the COVID-19 prevention measures, even as they access the stadium to come and watch the beautiful game of football.
The situation on the Copperbelt is worrisome. Residents need to get back to the guidelines and help stop the spread of COVID-19.
At Copperbelt, in particular, we had 393,944 cases, and we have sadly lost 51 individuals from COVID-19 during this particular period of time. We have done 60,000 tests for COVID-19, hand washing, hygiene, and other measures that we have been speaking about to control the pandemic COVID-19. I must employ everyone to sustain these preventive measures.